Good evening. My name is Lisa Cervantes. I'll be interviewing Tanya Cornejo. This is our second meeting. She has been working as a professional registered nurse for the last 10 years, and she's trying to have a career change, which would otherwise also entail she has to pick a graduate school degree program. So she's having some issues because of her previous academic history. So this is our second meeting. Come on in. Hey.
Hello, Lisa.
Hey, Tanya, how are you? Great to see you again.
Likewise.
Okay, so it's been a month. We had some follow-up work to do. From our first meeting, we kind of laid down the rules that this is confidential. Mm-hmm. And that we'd be doing this in about 3 sessions, and that our goal was for you to decide on a school to apply and try to be accepted into, even though there is some background work due to your previous academic history, because since you've been working as a registered nurse for the last 10 years at the bedside, you kind of want a career change. Mm-hmm. You want to be a nurse practitioner, and also we wanted to revisit what kind of nurse practitioner you wanted to be. There's different specialties, and kind of also explore if this is the right time for you, your family, mm-hmm. also your current employer, your situation with your current employer, how's that going? So I gave you some things to think about and to research. Did you pinpoint any programs in the area that you think would be a good possibility for you to either interview to see if they could devise a plan for you to get into the program, or just how to go about just broaching the topic with them? There's quite a number of schools in the area that do have graduate degrees in nursing. So
I'm looking currently at Long Island University and also Lehman College. They both have family nurse practitioner programs, which I think would be ideal for me, being that my background is in the neonatal field, and I've had previously done gerontology, so I have some adult experience. I wanted to make most use of my experience. I don't know that if I just choose neonatal it would be ideal, because then I feel like I would miss out on a bunch of options.
Yeah, I understand. That's a very specific niche area. Mm-hmm. And to be a nurse practitioner, you sometimes have to be in different settings, correct?
Mm-hmm. Yes.
Tell me a little bit more about what attracted you to becoming a nurse practitioner, because from my understanding, nursing at the bedside in your hospital, it's a very enriching experience. So tell me what would be your ideal situation in 5 years from now?
So 5 years from now, I hope to be working in a primary care area. I think the bedside has been very rewarding for me, but it also feels a little like I'm not making as much of an impact as I possibly could in the community that we serve.
Okay.
I think that the family nurse practitioner is ideal because I would be potentially seeing patients at all different levels. And I think that the point in time when a patient is diagnosed with, say, diabetes mm-hmm. or hypertension, it's kind of a time of transition mm-hmm. where there is a lot of things that can get lost.
Okay, yeah.
Most people will say, here, take this pill, and then this will fix you, but I believe that there's more to it than that, and that these people need a lot of support. Okay. So, the medical field currently, there's so few doctors to mm-hmm. serve so many patients. They need help. And
That's
I
right.
feel that as a family nurse practitioner, I can offer my help mm-hmm. and have the time and the luxury of working with these patients mm-hmm. to help them transition, not only as individual patients, but in their general lives, mm-hmm. Dealing with their families, with their cultures, the type of food that they eat, all these things have an impact. And even, the family as a whole, I think, is really where it is. You know, we live in a multicultural area where parents, grandparents, children, grandchildren all live in the same household.
Okay.
You know, people are being pulled in different directions.
Okay.
So it's not always easy to deal with. I have to take my medication, or I have to check my blood pressure every day. You know, people are so busy that these things can get pushed to the wayside, but they're very critical in order to help our patient population to improve.
Yeah.
So I think I would be better served to do something like that, have an impact at the beginning, or help patients get healthy, and if they're not so healthy, to help them to transition to new ways of living, dealing with different diagnoses.
Okay. So it sounds like you've really thought about your decision to become a family nurse practitioner, not just any, not adult gerontological or even peds, but a family. So you want to deal with the whole family as a whole and with the community. I really congratulate you on that decision. So for you to be a nurse practitioner, a family nurse practitioner in 5 years, there, of course, you have to get into grad school. So I know from your previous academic history, you did well. According to your transcripts, you did great in all of your nursing programs. There was like a C+ here and there, but overall, your nursing major, you did excellent. But unfortunately, I think maybe the first 2 years of college, I understand there are factors of like non-nursing or health science related classes like philosophy. I see you didn't do very well.
Yes.
So unfortunately, I can see that it brought you down to a 2.999.
Yes.
So that does happen. Have you where did you graduate from your undergrad?
I went to I went to Hunter College. In the beginning, I was commuting. It's a commuter school. I was adjusting to getting to school on time, and like in high school, I really didn't have to study to get good grades.
Okay.
But once I got to college, I realized that I needed to study, and I didn't really have the greatest study skills or the greatest work ethic in the beginning. So I honestly didn't, because nursing was my plan, my ultimate goal, I really didn't give that much weight to those general classes that I should have. And I think it was just an issue of maturity, honestly. Things were going on in my life as well that affected me and my ability to be able to really dedicate myself to my studies, which is not an excuse, but it definitely was a factor, and it really did hinder me. And even getting into the nursing program at Hunter was quite a challenge.
Yeah, I mean, you did excellent.
They're very competitive.
Yes.
But, I really did have to prove myself. And I'm hoping that Lehman or LIU will help me get to where I need to be. I mean, they require 3.0. Like,
You're
right there.
You're right there.
I'm right there. And with my experience, and I think if I can just speak to someone and let them know my passion for really going into the field, if I could get that across to someone, I'll take a class. I'll do whatever. I'm willing to work with it. I just need your help. I don't know where to begin. Okay.
So from my experience, I would say the best thing is for you to set up appointments with the graduate nursing advisors at those two schools. So one school is private and one school is a City University of New York. So definitely the private school, it's a very expensive school. Okay. So they'll definitely talk to you, and at the same time we'll revisit the whole, maybe the financial background, how that would affect your lifestyle, if it's something realistic for you, let's say in 2 years to do this program. And then of course the City University of New York, which is Lehman, they're very competitive. There's a waiting list of folks to try to get into that nursing program, but I think it's also worth a try to interview them and see if they can strategize a way for you to prove yourself that you can do the work. I think that's what it is. They want to make sure that you can do the graduate level work and not not falter I mean, they, as always, they do have accreditation that they are worried about. But I think if you prove to them, especially you have 10 years of experience,
Yes.
you're really passionate about what you want to do and how you want to affect the community. I think, your next steps would be to set up appointments, one with LIU, the private school, and the other one with the public school, the city university, and compare and contrast the programs and the strategies to see how, if they're willing to take you on, what would they recommend? Would they recommend you to do a bridge class? Sometimes they want to make sure you have the writing skills. It's going to be a lot of research, academic writing, or maybe they want you to reduce some of your like you did get a C+ in nursing research. I don't know what happened there. I mean, maybe they want you to might want to redo some of your nursing classes over like 1 or 2 just to boost your GPA. So depending on that program, and then of course, let's imagine ourselves. You get into each program. You really definitely have to compare and contrast how the programs will work in 2 years, and how that's going to work with your work-life balance, especially you're currently working full-time.
Yes.
And how does that impact your family? If it's do you have to scale back at work? Because at one point, the clinicals, the latter portion of the degree program, it is quite heavy with the clinicals. It's a lot of running around, getting to your sites, and then of course any obligations you have with your family and with work. So we'd have to, like, maybe in our next session we have to think of a way how that would happen down the road, just to prepare yourself, and see how that would work for you, and of course it's always to be at the right place at the right time, and see how it might work realistically with your current position. Would your position change maybe in the next 2 years if you happen to be going to school?
I doubt that I would
Okay.
look anywhere else, especially if I'm, with my seniority. I can work out with my colleagues a schedule that could accommodate classes at minimum. I am worried about the level of commitment that I would need to have when the time comes for my clinicals, because I just don't see a way to be able to work full time and get in all those hours. I mean, both programs are very high on the amount of hours that they require me to do in the clinical areas. So I have 2 kids. One is 8 months old, the other one is 3.
Oh,
and
you're very busy.
It's a lot of work at home. I mean, I don't foresee my husband not being able to help me, and his mom, she's always willing to help us too. But I think, there's a lot of things for me that I feel very apprehensive about really making a commitment. I mean, I want to do this. There's no question. I can't see myself being at the bedside for much longer. Till I graduate, sure, and get my certification, absolutely. I wouldn't leave the bedside until all of that was in place. But honestly, this is the only way that I can foresee that I can build a life for me and my family financially. Right now, my husband and I have to figure out on holidays when the kids don't have school, who's gonna take care of them. Yes. If I can get the day off, then maybe I can do it. If not, then he has to do it. But then he doesn't always have the option of taking a day off on a holiday. So our income is affected. Yeah. Whereas if I was in a clinic, the clinic generally tends to be closed on a holiday. It does. And the weekends, absolutely. Maybe some clinics will give me the option of working a Saturday here or there. I don't know. I mean, but the doctor I go to has Saturday hours, so I'm assuming I could probably work that out. Exactly. Once I get there. But, I just think it would be, just overall, it would be a better fit for my family. Because even though 12 hours gives me a lot of flexibility right now, it's, I'm not with my kids when they go to bed. And I feel like I'm missing out on that time with them. Yeah. I think it would be advantageous for me to do it now, where they're young and they maybe won't remember, than in their more formative years when they will notice that I am not there.
That's correct. That's really it's a good forethought in the future about how you want to have that relationship with your children and still have, you still want to love your job still.
I love
Exactly. So you want to continue
Yes,
staying in nursing.
exactly.
So you're definitely really thinking about this.
Yeah.
So I was gonna ask you, what would be a plan B if it didn't? Let's say you didn't get into any of these programs. Is there a plan B that you'd be thinking of? Nursing is a really wide and varied career. Would there be something else you'd be interested in?
Well, I've also, because I'm my mom's diabetic and she died from complications of diabetes. I feel like maybe something in patient advocacy, maybe diabetic nurse educator program, I would be willing to explore. But I really, I mean, that would be a super plan B, not my plan A. Like,
Yes.
I want to be able to help patients in a much greater way.
Okay.
And while diabetic nurse education would still help me have an impact, I feel like it wouldn't be what would fulfill.
Yeah, it doesn't sound like you'd have a passion for it.
Exactly.
Like you would have more like with community health, dealing with whole families.
Yes.
You sound like you're very passionate about it.
I mean, my life experience is what is driving my passion. Like, I want to help patients who are like my mom and to help them throughout their life. If my mom had been helped in that way, maybe she'd still be with us. But,
Yeah. Okay.
that's just something else.
So you definitely have a goal. You definitely want to be a family nurse practitioner, and then the biggest obstacle now is trying to get into grad school. With per your previous academic history, it's right there on the margin that it's possible, but you definitely have to have a lot of interviews, appointments. I would say definitely interview and network. Treat it as a networking opportunity with those academic advisors at the graduate nursing school. I mean, I would say my biggest advice is be absolutely candid, and let them know, show that passion, because then of course we'd want this nurse as a student here, and somehow maybe they would strategize a way to get into their program. And you definitely have to, I would say, weigh the pros and cons of each of the tracks of the different schools. One's definitely private and one's definitely public, and see what works for you. And of course, we'd have to, maybe in our next session, we'd revisit the financial obligations and how that may impact your family.
Okay.
Luckily, you do have employer reimbursement, and see if that's something that's realistic for you maybe in the next 2 years. Ideally, when would you like to complete your graduate degree program? Because you'd be working full-time and going part-time to school. I don't want to infer. What would be realistic for you? Or do you want to take it, or just first meet with those academic advisors and see what would be realistic for you?
Yeah, I think I would have to look at the curriculum and see, what they recommend, a part-time versus a full-time. Obviously, the least amount of time would be ideal, but then considering all the things that I have on my plate, it would need to be something that would fit my needs at this time. So I'm really open to either course of action, and I mean, I'm not going to stop coming to see you, that's for sure.
Okay.
Throughout this process, I think I really need your guidance. Because honestly, all I know is that this is what I want to do. And I don't want anything to get in the way. But I understand that there are obstacles that I am clearly need to overcome in order to make sure that I get to my goal. But ideally, in 5 years' time, I want to be certified, completed my program, and either starting to apply or starting a new job.
Wonderful.
As a nurse practitioner.
That's
crossed.
Yeah, that's a great 5-year goal. That's awesome, because sometimes you want to get into graduate school, but you're not sure what's going to happen after you're admitted. So I'm glad you really have a plan, you have a frame. So we'll try to use like micro goals, like really step by step to get to the main goal. So I think we break it down. It might be more achievable and not as daunting
Okay.
as it was before in our first meeting.
Yeah.
That you thought it was not a possibility to get into grad school just because of that slim margin. Because according to a lot of school websites, that's the minimum is a 3.0.
I know all of them.
Yes. So I think right now we're in a better place.
Okay.
And I would say for our next meeting, our next steps is you should set up some appointments with each of these schools.
Okay.
And also at the same time, don't hold back in reaching out maybe with any other colleagues that you work with who have gone through similar programs. Then maybe they can recommend the academic advisors from their school that they've gone to. Don't limit yourself just to these two. Try to, I would say, cast a wide net.
Okay.
You have some time. I mean, the biggest thing is to try to get into the program.
Yeah.
So,
I have a couple of coworkers who are in PACE. So I think I'll look into them.
Exactly, and that's a private school, and they're very reputable.
Okay.
So try to cast a wide net, and then basically maybe we'll table all the pros and cons to each program of getting into them, and then see what would really be realistic for you to achieve your goal of being in 5 years a certified family nurse practitioner.
Okay.
Okay, so do you have any questions for me?
No, I think you've given me a lot.
Okay.
But I'm very much looking forward to speaking to these schools and seeing what they can do to help.
Okay.
I mean, I think you've been really, really helpful so far.
So we'll make an appointment.
Sure.
Awesome. All right, Tanya.
Thank you
I'll
so much.
see you next
Lisa.
month. Okay.
All right.